Whenever you're ready.
Welcome to another edition of Points of Interest, brought to you by the Lebanon Area Chamber of Commerce. My name is Paul Boucher. I'm the President and CEO of the Lebanon Area Chamber of Commerce. And as we do each week, we present to you the goings-on in the Upper Valley for this coming week and have a special guest. And this week being no different, we have the President and CEO of the Alice Peck Day Memorial Hospital with us today, and talking about the big doings going on over there, the exciting things that are going on at the hospital that they'd like everyone to know. So beginning this week, and talking about Alice Peck Day Hospital, we have on Wednesday a blood drive from noon to 5 at the hospital. And I always say, you know, if you come in a little late, they'll wait for you and draw your blood. And there's always a need for blood, so that is on Thursday at Alice Peck Day Memorial Hospital. We have on Thursday a book buffet in West Lebanon at the Kilton Library. This is at noon to 1 p.m. Bring your lunch and join a discussion about nonfiction books that examine New England's natural world. So if you want something to do for lunch, bring your lunch with you and enjoy that. Also on Thursday, Sharing Shaker History in Enfield. That's at 6:30 to 8:30 p.m. at the Enfield Shaker Museum on Route 4A. Third of 4 weekly discussions with curator Michael O'Connor. That's very interesting, the archives and such that they have there at the Shaker Museum. One of the things I always like is the community dinners, the church suppers, and those are abounding. We have one on Friday at the Methodist Church in Enfield, 5 to 6:30 p.m., and it's a chicken and biscuit dinner in Enfield, 5 to 6:30 at the Methodist Church. Here in Lebanon, we have Morden Swing Dance. Anybody want to get into swing dancing? 7 to 9 p.m. On Friday, and social and performance level dancing. No partners necessary. You need to call Faye at Grierson, Grearson, at gmail.com for that event. Also in Enfield, a lot of activities going on in Enfield. The Other Place, it's a play put on by the Shaker Bridge Theater. A drama by Shar White explores the narrative integrity of a woman confronted by a medical crisis. That is on Friday at the Shaker Bridge Theater right there on Main Street in Enfield. Then there is a fundraising dance in Plainfield on Saturday, 7:30 to 11 p.m. at the Town Hall. It's a dance with Dr. Burma, and his group has been around for a long time, and a silent auction, and the money is for the Hand to Heart Project, which provides free massage to people with advanced cancer. So it's a great event to help support that program. In Canaan, we have weekend walkers in Canaan, 9 to 11 a.m. on Saturday. You meet at the Mascoma Valley Regional High School, and it's just a community walk inside. Now, those of you said, oh, it's too cold to walk outside. Well, they're going in the hallways of the high school, and they're going to repeat it in the afternoon on the same day if you can't make the morning, 10:30 a.m. to 5 to 7 p.m. They're going to be doing it on that particular day. And then there's an Italian Conversation Club in Enfield, and that is on Saturday at 10 a.m. at Mickey's Roadside Cafe. Conversation and cultural enrichment for all ability levels. So if you're thinking of picking up Italian and going to Italy, it's a good place to start. We also have on Saturday a kids benefit auction in Lebanon, and that's at the Methodist Church, 5 to 7:30 p.m., and live and silent auction of items donated by area businesses. That is on Saturday, 5 to 7:30 p.m. at the Methodist Church here in Lebanon. Then we have, again later that evening, dinner performance in Lebanon. The First Congregational Church is doing dinner improv show featuring Quicksilver comedy players, and the benefit for that is WISE. Entry is $7 for the show, or $15 for the show and dinner. Upper North, having a gala in Lebanon, 6 p.m. Very busy Saturday this week. Classic classical music theater, live and silent auctions, and food, all to benefit Opera North and the wonderful performances that they do here for our community. Coming up, and it may sound a little early, but 7-time Grammy nominee Joan Osborne is going to be at the Lebanon Opera House on April 19th, Saturday, 7:30 p.m. performance, and very popular multi-platinum selling recording artist. So that's Joan Osborne, April 19th, and we'll keep you abreast of that as it goes along. But I would suggest that you call early for tickets because it will be a sellout. Number there is 448-0400 to get more information on that. And then we have SCORE. SCORE is running a lot of winter workshops. Next one is this week on April 3rd. It is selling and advertising. And it says, to be a successful running of a small business, you need to know how to market your product or service. And they'll tell you everything you need to know about marketing your services and your products. On another note, SCORE is also from 9 to 1 p.m. on Wednesdays, has a walk-in service. So if anybody needs of their service, they're sponsored by the Small Business Administration, and they have experts in any field who are, as it says, Service Corps of retired executives who can help you with your business, either start a new business or help you as you go along in your business. And so manufacturing, marketing, any of those experts are there and be glad to help you out. Totally free, as I say, sponsored by the Small Business Administration. As I mentioned at the outset, we have a special guest. We have Sue Mooney, who is the president and CEO of Alice Peck Day Memorial Hospital. Welcome to the program.
Thank you.
And Sue has recently been appointed as the president and CEO, and we welcome you, congratulate you on that event. So it hasn't been a year yet, has it?
It's just coming up on a year,
Just
right
coming
about now. Yes.
Right about now. So still new in the job, but she'll tell us a little bit about her background and how she got to this position and the exciting things going on at Alice Peck Day Hospital. A little bit about your background, where you were from, education, that type of thing?
Yeah, sure. I grew up in New Jersey and did my medical school training at the University of Pittsburgh. After that, I went out to the University of New Mexico and I got my residency training in obstetrics and gynecology through the University of New Mexico in Albuquerque. I always aspired to live in New England. I had spent summers in camp up in the Burlington area. Really loved the region, and so when it came time to look for employment after residency, I came back and got a job with the Hitchcock Clinic down in Nashua. Oh. So I worked at Southern New Hampshire Regional Medical Center for Hitchcock for a couple of years, full-time OBGYN. When a job opened up at APD, I relocated my practice. So I've actually been with APD since 2000. And for the first several years that I was there, just full-time OBGYN. So strong clinical practice. I didn't
realize you were here that long.
Yeah.
Oh, wonderful.
Somebody just asked me that today. I'm coming up on 14 years
wow.
At Alice Peck Day. And so really didn't get into administrative work until sort of 2007. I had taken some time off from my clinical practice to get some additional training through the White River Junction VA. They have a program called the Quality Scholars Fellowship. So I did 2 years with them, and I got a master's degree in quality improvement through the Dartmouth Institute. At that time, they called it the Center for Evaluative Clinical Sciences. But it was all about leadership and healthcare and policy and quality and how you can start to make a difference to improve healthcare for the benefit of patients. So after I completed that program and got that degree, I came back. Initially was the medical director for quality improvement at APD. then became the chief medical officer. And then when Harry Dorman decided to retire, he asked me if I would consider taking on as the CEO and president of the organization. So we had a really nice planned succession. He and I worked very closely together. So we did that in a really nice, organized way, which I think really benefited the organization.
In a lot of organizations that I'm either on the board or trustee of or whatever, this has got to be the smoothest transition I've ever seen. We didn't go through, 6 months or 8 months searches and
Right.
flying people in and interviews and that type of this. This was really great. As a former trustee, I really appreciated it. It really was nice and smooth.
It was painless, and I really credit Harry Dorman for a lot of that, because he knew he wanted to retire, and he didn't think it was the right time to sort of put the organization through a lot of ups and downs. So he orchestrated a very nice succession.
And you, having been there that long, knew the nuts and bolts of the organization.
That's true.
And the changes that went through in the 12, 14 years. Yeah.
Right.
So, upcoming, the great news that you have for us that's happening at the hospital.
Yeah. Alice Peck Day just completed a very comprehensive strategic planning effort. And the piece of that really has made the news is the piece about the affiliation with Dartmouth. But there are other components of that plan that we think are really pretty exciting and pretty fun. One is when we think about Alice Peck Day, we've got our life care business, which is Harvest Hill and the Woodlands. And we have done a lot of work to think about how that facility can interface more with the community, how we can really make a commitment to becoming sort of a geriatric center of excellence, commit to aging in place, start to think about how we can use our facilities for the community. So we're very excited about some of the work we're doing in life care. We've also done a lot of work thinking about our outpatient clinics. So we think of APD as a hospital, but we have a lot of activity that happens in our offices, our physician offices. And what we realized is that those offices they're organized for our benefit as a provider, not for your benefit as a patient. So you come to see the doctor, and then you got to go over here to get a lab and over here to get a x-ray, and then if you want to see a specialist, they're in a different building and you can't see them till next Tuesday. So we think sort of rethinking how those practices are arranged and really thinking about a one-stop shop for patients, and organizing the delivery of those services for your benefit is something really important. We also think that we want to be able to meet your needs on your timetable. So often in our healthcare environment now, you call to get an appointment because you've got an acute issue, and you're told, well, we can see you 3 weeks from next Wednesday, which is why people end up in emergency rooms or other places. We've got to figure out how to take care of primary care on the timetable that is appropriate for you.
Will that mean a movement, for example, moving radiology from the main building down to the Mesropian Center?
That's a great question. So parts of it we would absolutely want to move. So things like mammography, ultrasound, DEXA scanning, which is bone density for osteoporosis screening, certainly our x-rays for our orthopedic practices, being able to get those services at the place where you're going to sort of talk to your doctor about them really just makes sense to us. So some services stay in the hospital proper, but others do get moved to a place that's more convenient for you.
For the patient.
Correct.
So that leaves a little more space in the hospital, although I think you've taken care of some of that with the renovations.
Yes, and people ask a lot about what about the rest of the renovation, and so Alice Peck Day, we were in the midst of a pretty big renovation. we completed phase one, which if folks haven't been to see that new construction, they really should, because it's really absolutely beautiful. We consciously sort of put phase two of the renovation on hold because we really wanted to think about the strategy and what were we going to use the facility for. Now that we have a clear vision of where we're going, what the next 5 years look like, we really intend to get back into these construction projects. And so we anticipate that phase two of that renovation project will come back around in terms of conversation and thinking about when do we get it done.
But you still have an emergency department.
That's correct.
I know we had, when I was on the board, talked about having a hospitalist there. Do you have a hospitalist?
Yes, we do.
Okay.
We have a hospitalist on site from 7 in the morning till 7 in the evening, and then we have night coverage. The emergency room is open 24 hours a day, 7 days a week, and there's a physician there. One of the things with the affiliation with Dartmouth, one of the real driving forces behind that is the recognition that we serve the same patients often and that we live in the same community and that we have overlapping missions. And so the real name of the game is how can we work together to deliver services. And one of the areas that we're looking at is around this idea of provision of emergency services and provision of in-hospital services. So we know that there are patients who end up at Dartmouth, which is a tertiary care center, whose needs could be met at a place like APD. We also know there are patients who are in the ER at DH who could get their needs met at a less intense ER like an APD facility. So part of the drive to affiliate is to say how can we sort of pool our resources and get the right patient in the right bed at the right time. And that's to improve the overall health of the community that we serve.
So a lot of people think that because it's a small hospital doesn't offer those services, but total services. Birthing center
Yes.
still
Yes.
Birthing
center still something that we are very, very proud of. We do over 300 births a year. We have exceptionally high quality and probably some of the best patient satisfaction scores you'll ever see. So we're clearly known for our obstetric delivery. So very high quality service. The challenge with obstetrics, I think, is really a regional challenge. The payment around obstetrics is poor, and so you've seen lots of small hospitals get out of the business of obstetrics. So New London Hospital closed their birthing center, Valley Regional closed, and as that happened, women have fewer and fewer choices. More and more people sort of get shifted to a Dartmouth type facility, again, a tertiary care facility. So the thought is, how do we start to look at collaboratively Dartmouth with their resources and APD with our resources, how do we pool our resources to provide the best that we possibly can.
Mount Scottney, did they offer the service? Have they ever offered
I
the
don't
service?
know that they've
I don't
done
hear
it
of it,
for
that's
years
why.
and years.
Yeah.
Certainly in the time that I've been here, they have not.
Yeah. So it's difficult for someone to find a hospital to deliver.
Absolutely.
I mean, in this rural area.
It's very, very challenging. Yes,
And,
not an easy thing to find. So we think obstetrics is something that we do very, very well. It's challenging to staff a birthing center 24 hours a day, 7 days a week, to staff the operating room so you can do cesarean deliveries, to make sure that you can respond, and get a C-section underway within a certain period of time, So that's again where we think that working with Dartmouth as opposed to at cross purposes can really allow us to improve the quality of care that we provide in the community.
And you have doctors on both sides of the river that, those are in private practice, who refer their patients to Alice Peck.
That's correct. Yes, we have.
A lot of people think it's just Lebanon, but there's...
Yeah, we've got lots of good sort of working relationships with many different primary care offices. So the biggest office over across the river is White River Family Practice, and those practitioners have been on our medical staff for years and years, and they are, I think, very savvy about sort of saying to their patients, you can get this service appropriately at Alice Peck Day. They're going to do a really good job for you. For this, you really should be at Dartmouth. And so they are very savvy about helping patients to make smart choices.
Sure, sure.
You know, there's some things that we do really, really well, and then there are other things that Dartmouth does really, really well. And the trick is making sure that the patients are going to the right place to get their care needs met.
Throughout all of this, there's a lot of concern out there, I know, of people concerned with the affiliation with Dartmouth. You're still going to be independent Alice Peck Day Memorial Hospital.
That is correct.
With all of this that's going on.
Yes. The real driving force behind this is that we think that the payment model for healthcare services is going to change. So right now we're in this fee-for-service world. So every time you see a doctor or you have a test done, we make money. Whether that is a benefit to you or not, whether we get your blood pressure under control or we meet your healthcare need. We think that the healthcare system is going to change to say it's not good enough to just see the patient. You really have to meet their need. And so if we change from paying for just doing more to paying for really truly doing a service of value to the patient, that's a very different mechanism. And in order to provide high quality, high value care, what we really recognize is that facilities have to work together. You can't not collaborate and coordinate care. And so DH is leading the way to say we're going to look at a different payment mechanism that leads to a different delivery system. And that system looks like a network of providers who are all aligned around a common goal, which is high value care. So APD wants to be a part of that future. It's not about sort of everybody looking like DH. It's just about everybody pulling in the same direction. So we'll still be APD. We maintain our corporate identity, our cultural identity, our personalized care, our we like to say that it's high touch care where people really, when they come to APD, they feel like they've got a personalized care experience. We're known for that, and I don't think that's going to change at all.
It'll be the same. It seems in the last few years a lot of attention has been to preventive.
Yes. Yes.
Medicine, preventive, totally, and encouraging people to change their diets, do exercise, that type of thing. Has that affected the medical community at all?
I think it's really impacted the medical community, and I think what we're recognizing is that our primary care practitioners really need to shift from treating disease to working with patients to prevent disease. And the only real way to do that is to really engage with people around these modifiable lifestyle issues. So, losing weight, quitting tobacco, exercising more, etc. These are all things that we really know are important. And, so we've got to get involved with helping patients to make healthier choices, and that involves the community, right?
Oh, sure.
That's not just us. It's how do you play your role in creating a healthy community.
I'm going to ask you a loaded question now.
No.
With ACA coming on board and Anthem, is it?
Yes.
Pulling out of a number of hospitals in,
yes.
In the state. Did that affect Alice Peck at all with?
Sure.
It did with.
Well, yeah, you know, I think the decision by Anthem to exclude us from their products that are offered on the exchange, in and of itself, didn't hurt us because there weren't, quite frankly, that many patients who got their insurance through that specific Anthem product, and their other Anthem products didn't exclude us.
Oh.
It was they really, it was just the products that were offered on the exchange that went with this narrow network where certain hospitals were excluded. We were obviously very concerned about it because of the implications for what does that mean for the future? Is this going to be the wave of the future? We also know that it's early in the exchange sort of world and that other insurers are coming on and they're going to take a different tactic to try to compete. So yeah, we were concerned. We weren't really adversely impacted. We're very concerned. We've been paying a lot of attention to where it goes. But I think that we took sort of a wait and see attitude towards, you know, how does this play out? The ACA is in really the first year of implementation. And I think it's pretty dynamic. It's not static.
No.
What's happening in healthcare is
if we believe everything we read in the press,
right.
It's really catastrophic for some people.
Right.
You mentioned passing a little bit too on the Woodlands and Harvest Hill. I was pleasantly surprised to hear that Harvest Hill is fully occupied.
Correct.
With a waiting list, but there's still some openings in the Woodlands. What type of services do you? I'm interested in Woodlands, for example. What do they have for me? Sure.
Yeah. So Woodlands is a supported senior housing facility. We have a number of apartments, and so we what that looks like is independent senior housing. But the facility itself includes a number of facilities. There's a fitness center, there's a wood shop, there's a theater, there's a craft studio, there's a dining room with gourmet dining, there is buffet breakfast, there are trips and activities, etc. So it's really a community of folks that are not wanting the responsibility of a house and a property, but are still living independently. It's really a beautiful, beautiful facility.
It is. It's gorgeous.
It's absolutely beautiful facility.
In talking to some of the residents, the highlight is is your culinary.
Absolutely.
I don't know who you have, but
right, the chef
loves the food there, and the atmosphere. I happen to be there when they go into the dining room. They've got a hostess that meets them and takes them to it. It's like going out to dinner every night of the week, and they meet with their friends and talk, and it's really. As you say, somebody who doesn't want to maintain their own home, and with all of that, and may go to Florida in the winter and come back or whatever.
Right.
But it's a great facility. And
it is a wonderful
there is some openings if anybody is interested for that. Right. Well, Sue, we thank you very much for being with us today.
Yeah, thanks for having me.
Enlightening us on the goings-on, and we wish you luck as you enter your second year.
Thank you. I appreciate that.
Quite all right. That's another edition of Points of Interest, brought to you by the Lebanon Area Chamber of Commerce. And we'll be back next week with another program. Until then.